I think when we're doing a good job at public health, it's when you don't see it. Say, for instance, we're in a pandemic. There was a lot of talk about how social distancing doesn't work and we don't need to wear the mask. But then when you're able to show someone and say, but look at the numbers are actually decreasing. The mortality is actually decreasing because those public health measures do work.
Our department teaches foundational concepts that make students ready to lead studies, examine biases and address them. We have expertise in environmental science and cardiovascular disease, cancer. One of the hallmarks of our department is that we have many faculty doing research in social determinants of health, which is a little bit different than other epidemiology departments.
How do we consider health and health states that are a manifestation of things that are outside of us? I am a person who was born in an inner city in Los Angeles. That inner city did not have access to a lot of healthy fruits and vegetables and things. Even though I myself might want to eat healthy, if my neighborhood doesn't provide those options for me and is poorly resourced, then I'm going to be a facet of that.
People get to know the data and real-world problems when you're doing the biostatistics. So that becomes very different from very traditional way of studying in classroom and getting all the knowledge from the textbook. You got to speak to the, say, the health practitioners to know their problem and to learn more about their data before you can find any analytical solutions.
New technology is often, utilized and grabbed by people who already have a lot of resources. We're building Rosie, the chatbot. So Rosie is a question and answer chatbot for new moms. So when we chose the population for this chatbot, it was going to be racial ethnic minority moms that already have desperate burden of maternal mortality, high infant adverse birth outcome. And we're designing Rosie for that population to intervene and reduce health disparities.
We are minutes away from the nation's capital, which means we're also minutes away from a lot of federal agencies and the policy action where epidemiology can be applied, boots on the ground kind of impact, and we can advocate for improvement in our healthcare.
We've got students who want to do internships on the Hill. We've got the FDA, we've got HRSA, we've got National Center for Health Statistics right here in Hyattsville, we've got CDC, we've got USAID.
One of the strengths of our department is just the collaborative nature of the faculty, and that benefits both, faculty and students.
Compared to other programs, I have had the best experience in terms of support at University of Maryland. And that really comes from a non-competitive environment with my peers. We all really lift each other up. The other component is the professors and the faculty here, because they are really very supportive in a way that I haven't found very often elsewhere.